Hello, everyone. My name is Valerie Manu, and welcome to today's webinar, Updates and New Federal Stimulus Funds for Childcare Impacted by COVID-19. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. All participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. And with that said, I would like to now turn it over to Kathy Glazer.
Thanks, Val, and welcome everybody. So glad you could join us this morning to learn a bit more about the new federal stimulus funds that Virginia has received recently to support child care programs who have been impacted by the pandemic. Our agenda today, as you see on the screen, will flow as follows. First, we'll have the wonderful opportunity to hear from Virginia's First Lady, Pam Northam, who will share her greetings and comments. Then she'll turn it to Jenna Conway, who is the state's Chief School Readiness Officer. And Jenna will provide the details on the briefing. And then she and Tara Ragland, who is the Director of Licensing Programs at the Virginia Department of Social Services, will be available to answer your questions throughout the next hour and a half or so. And so with that, what a privilege to welcome Virginia's First Lady, Pam Northam.
Hi, Kathy. Thank you so much. And thank you to Virginia Early Childhood Foundation and all the folks who are helping us with this webinar today. And thanks to our wonderful providers who are joining us. We are so very appreciative. I know these are challenging and unprecedented times, but the governor and I thank you so very much for the sacrifices you all are making to keep yourselves, your families, your students, and your communities healthy, safe and healthy at this time. So thank you so very much for that. Many of you know that as a pediatric occupational therapist and an educator myself, that we've worked really hard, my team and I, over the last 2 years to really increase access to quality early childhood care and education. We've done over 5,000 miles across the Commonwealth, meeting many of you, having the great joy of meeting many of you and your students. I've been able to read stories and participate in fun games, and it's been a true joy for me to get to know you. We sat down and listened and said, how can we as a state best help you? And it became abundantly clear, and even more so now, that you are the most important part of early childhood care and education, the superheroes that do this work day in and day out. And you know, if there's any silver lining to this difficulty right now, I'm truly hoping that people will join us in recognizing your amazing contribution as professionals and what you do. It's important now that we care for those who care for us, and your essential work caring for the children of our frontline workers is so important now. But I'm hoping that overall people will begin to realize that what you do is so very, very important and so vital to our most precious resource, our children. You know, we fought very hard after listening to you again and hearing the troubles that you're having right now to quickly get a hold of that $70 million and get that out the door to you as soon as possible. And that's what today is all about. And I'm so glad to be able to hand it over to the experts. Jenna Conway, our state's first Chief School Readiness Officer, who's been heading our Early Childhood Project, helped us to pass some legislation this year and to get some important budget dollars for all of you. She's not only a nationally known expert, she has 3 little ones of her own. In fact, she sent me a video of her youngest toddler, let's say, having a disagreement on the floor. I think something you all can understand in your work as well. But she's a wonderful expert in many ways, and I look forward to hearing from her. Again, we thank you so very much from the bottom of our hearts. We hear you, we see you, and we thank you.
Wonderful. Thank you. Thank you, First Lady, and thank you, Val and Kathy and everybody at the Virginia Early Childhood Foundation. We are very appreciative to be here this morning and to be able to share what we're doing to support you all in the field during this challenging time. I also wanted to express my appreciation for the incredible work that you all do, whether you're open right now and continuing to serve children of our personnel, whether you're temporarily closed, because that's what is needed for your educators or your families. We know this is an extraordinarily difficult time, and that there's been a lot of loss experienced by the sector. We know that folks are closed, are desperately missed, and it's just a very tough time. What I'd like to do this morning with my colleague, Tara Ragland, is to take us through what we know first, provide you with a snapshot of where we are as a state. We know in a very isolating time, and in order to keep us safe, a lot of us have sort of isolated, but we also know that can be lonely and it can be hard to understand what's happening kind of across your community or across the state. So wanted to start with sharing that landscape of the statewide perspective so you have an understanding of what's happening more broadly in the early childhood sector in the Commonwealth. And then to talk about our priorities before getting into detail, as Kathy described, about the specific CARES Act or stimulus funding that we are dedicating to support the early childhood and child care sector in the Commonwealth. And we think it's important that you understand our priorities, or we explain the why in terms of what has made these decisions, what we've heard from you and your colleagues in the field, and how we're using that information to inform the decisions on how we get more resources. And so just really wanting to be transparent with you about not only where we are as a state, what that data tells us, what we know, what we've heard from you, what we're doing about it. And then with Tara's partnership, we'll take you through how you apply and then open it up for questions and answers at the end. Next slide, please. So again, just in a world where the news is on 24/7, the stories seem to change by day, their numbers and charts, we thought it would be helpful just to take a few minutes to explain to you what the current situation is in the Commonwealth as it relates to childcare and early childhood. So as everybody knows, really since March 13th, all public and private K-12 schools in the Commonwealth, including all preschool programs located in those facilities, have been closed and are required to be closed for the remainder of the school year. That puts about 1.2 million kids under the age of 12 in the Commonwealth who are either in care or in school and are now in need of care and supervision. The governor's executive order did not require the closure of childcare. Rather, there was guidance provided by the Department of Social Services, Department of Education, and the governor's office encouraging our programs to prioritize children of essential personnel, recognizing that we needed childcare in order for our society to continue to function, and asking folks to make some operational challenges in order to keep kids safe, keep families safe, and importantly, keep your educators safe. And so that guidance went to sort of more enhanced health and safety protocols with one of the most important changes going down to that group size of 10, inclusive of all adults and kids in the settings. Throughout that process, as we saw these numbers have slowed a little bit, but roughly we had a pretty significant amount of closures across our child care programs. As of this week, 63% of our child care centers are closed, 63% of our religious exempt preschools. So our larger settings, those centers and those faith-based preschools, are temporarily closed. In contrast, in our family day homes, only about 1 in 4 are closed. So basically 3 out of 4 of our family day homes across the Commonwealth are reporting to us that they are still open. Many of them are already smaller settings, very familiar to families, already operating typically under that new group size, and a little bit easier for them to kind of continue to stay open. And their heroic work and staying open, we know, has been essential to making sure that our first responders, our health and hospital workers, and all of the other set of essential personnel, from the folks who drive our buses, to staff our grocery stores, to make sure that retail is there so we can purchase the cleaning supplies we needed, our food supply chain, all of those things. Huge thanks to those centers, those preschools and, largely those family day homes that have stayed open. Altogether, though, you're looking at about 2,600 childcare programs across the Commonwealth that have closed, representing a loss in capacity of about 210,000 slots. This number has been static for the last few days. So again, when you talk about these things like flattening the curve, we think we might have hit kind of a new normal, a new status quo, at least for the time being. And we're starting to see some folks thinking about reopening. But again, across the board, we're still hearing from providers that those who are open are finding kind of, classrooms are not full. There's still a real concern in terms of parents and putting their kids back in group care. And so we expect it will sort of stay steady at this rate for a little while. We wanted to clarify and just say this again, that childcare is allowed to be open and that childcare educators are essential personnel, who are serving essential personnel. And we think that's really important. The First Lady recognized your work as essential. The governor has noted that in his press conferences, and we want to make sure that that word is out there because you are keeping our society functioning during this kind of extended duration of the pandemic. We, the Department of Social Services and Department of Education, produced a letter that is available on the website. You can print, put your license number or your registration number on and use in case there's any question about whether or not your work is essential, and to help you if you need to at local grocery stores or Walmart to kind of demonstrate you should be a priority for critical supplies. So that's where we are as a state. Again, not everything is closed, but pretty significant closures. And as I sort of put it in terms of a ballpark, if you take 200,000 slots out of the system and roughly imagine that kind of it's $1,000 a month per kid per slot, you're looking at about a $200 million impact kind of across the state. So just to sort of acknowledge what a sort of huge impact this has been on the state, not to mention the emotional piece. And I know, again, as the First Lady noticed, my 4-year-old who comes and checks every morning to see if her childcare center is open today, that sort of the eternal optimism of a 4-year-old. We know that, it's been such a loss for kids, for their families, for families who need to work and are struggling to balance, and then for those programs who had to close. So what are we doing about it? And we wanted to kind of clarify, based on what we're hearing from you and looking at this data, are sort of 2 priorities in the Commonwealth as it stands today, April 29th of 2020. The first one is making sure that we continue to have enough emergency childcare, across the public and private sector through the duration of this crisis. And again, as I talked about before, you all are essential. We're asking you to prioritize essential personnel. We are defining that quite broadly as it relates to not only folks who work in the health and hospital system, our first responders, but everybody who helps ensure that society runs, right from the grocery store to the garbage worker to the postal worker to our food supply chain, kind of ensuring that all of those folks have enough care where needed, and really starting with the experts in the private sector and making sure that you're supported to stay open if it's a possibility for you, and recognizing the heroic work that you're doing. Our second priority is trying to deploy or use any resources we get our hands on and getting them out to the field. And so most recently, roughly just at the end of last month, Congress signed the CARES Act, and including $70 million for the Commonwealth that is required to go to support childcare. And I'll talk in some slides that follow about how we're doing that, but wanted to make sure that everybody was clear in response to what we're seeing in this data, this tremendous loss experienced in the childcare sector, these incredibly difficult times for centers, for homes, for kids, and for families. Our priority is making sure that we can support enough emergency childcare and figuring out how we get resources to you. Next slide, please. Wanted to give everybody, this is a hot off the presses update this morning in terms of talking about kind of priorities and continuing to be responsive to you, to let you know that the Department of Social Services, and partner with other state colleagues, has launched a new website and mobile app to help support individuals, families, and businesses related to kind of COVID-19 resources. We know it's like a fast and furious. There's this webinar and then there's that webinar, some put on by the state, some put on by federal or national partners, lots of letters and acronyms, and it's, can be a maze to navigate all of these resources, whether you're a family member who's affected, whether you run your own business or you work at a child care program. And so we wanted to let you know about this new resource that was launched yesterday. You see on there on the right side of the screen, that gives you a sort of a view of what the app looks like. You can find it right now on the Apple App Store, and it's going to come for Android and Google Play, but it's accessible. I downloaded it yesterday, and it's great in terms of just an easy resource that DSS can continue to use as more federal resources, kind of other stimulus acts are passed. It covers food, childcare, healthcare, housing, unemployment, and really kind of provides sort of the key 1 or 2 or 3 links to help you access resources. So wanted to make sure everybody's aware about that. Share that with your staff, share that with your families. It can really serve as an important connection to resources and pathways, both state and federal, making it a little bit easier for our families and for our centers to navigate the various resources out there. Next slide, please. So let me pause here and talk a little bit about our first priority before moving on to the detail of how we're getting resources out to folks that are open. So because these two, as you'll see, go hand in hand, right? We need to make sure that we have enough open programs in order to serve the kind of the essential workforce that has to continue to work throughout the duration of this crisis. Another new resource we wanted to make sure everybody was aware of is a map that our partner Childcare Aware of Virginia has produced that reflects the current state of childcare available in Virginia. So when this crisis first hit, there was a deep concern whether it was how many folks we would need in our hospitals, our ambulance drivers, kind of keeping our Target and our grocery stores running. We wouldn't have enough childcare in the private sector because private sector organizations would have the ability to close or might have to close. And so we wanted to work very closely with the public and private sector to make sure we had enough capacity. We realized there were lots of questions from communities. Do I have enough? Should I do a pop-up childcare center in my school or in my municipal building? Like where are we at when it comes to childcare availability in my particular community? Childcare Aware stepped up and began tracking through their data system, open programs, working in partnership with licensing and the field to then track the availability of care. The governor's guidance and subsequent advice from us has really encouraged folks to go first to the experts, to go first to the private sector. And so we wanted to make sure we had a resource that included all of our private sector partners front and center. We could see who was open, who was closed, who's located in proximity to a hospital. So as the health and hospital system, the mayors, the community, the municipal governments reached out to us that we were all using one resource to talk about what was available and what was not. So you see the website at the bottom of the page there. Our ask of you is if your program is not listed accurately there, please make sure that you go to that website, you click on your profile, or you can do a survey if you don't remember your login for your program profile. But please make sure you keep this up to date. When you're closed right now, it should be reflected that you're closed. When you reopen, don't forget to make sure you update it here. This is the one repository or the source for us statewide on who's open, who's not, and allows all of our communities across the state, in addition to state level leaders, to continue to track where we have enough capacity and where we don't. Because as we've learned that there has not been kind of the crush on our hospitals that we imagined. And again, we don't want to stand up a lot of emergency childcare in other settings if we've got empty classrooms in the private sector and our heroic teachers and childcare directors and leaders who want to serve kids. We know you're expert and we want families to go there first. And so making sure that we have an up-to-date map is critical as we support the private sector across the Commonwealth. Next slide, please. So let's shift now to kind of supporting, right, the kind of emergency childcare, supporting folks that are open. One of the things I also wanted to let folks know about, we know that there's been a lot of questions and queries about personal protective equipment, right? There's shortages across the board. There's shortages in the health and hospital system. There's shortages for those folks who are in the essential workforce, and that includes our leaders and our educators in childcare. And so I also wanted to just highlight something that our partner Childcare Aware Virginia sent around regarding purchasing key health and sanitation supplies. And so Food and Supply Source does have a limited amount of PPE, or that personal protective equipment, and hand sanitizer that are now available for purchase. If you click on the link in this presentation, which is in your kind of handout section of the webinar, you can look at the supplies and the prices. You can easily create an account online and then email Stephanie. Make sure you get your order in. As you note in the graphic on the right, you've got payment must be in full. There might be some minimum orders, and there's a little bit of a lead time, but really letting people know that there is this resource if, when you're going to kind of suppliers locally, you're finding that there's not enough cleaning supplies, PPE, hand sanitizer, all of those things that we know are running in short supply kind of across the Commonwealth and across the country. So I wanted to let people know about this resource. For those of you that are remaining open or are considering reopening, know that you've got this resource out there. Also, just a plug, if you're not receiving the Childcare Aware of Virginia emails, they're sending out a lot of helpful, useful information during this time. I encourage you to go to their website. You can just Google Childcare Aware of Virginia and to sign up for their newsletters as well. Next slide, please. So, emergency childcare, making sure that everybody's on the map. We're supporting the private sector, encouraging families to go to the experts first. A new resource as it relates to a mobile app for you and for your educators and your families, and a sort of a relatively new resource as it relates to kind of cleaning supplies and PPE, kind of supporting kind of, those folks who have to remain open. We then want to talk a little bit about what resources came available and how, particularly for, both some of our open programs as well as some of our closed programs, can access these resources to support the child care sector. So we know there's a lot coming out of DC. There's things like the PPP, there's unemployment. I want to talk for the next few slides about the Bipartisan Corona Aid, Relief, and Economic Security, or the CARES Act, which is really kind of the COVID stimulus, passed at the end of March. And what's awesome about this particular stimulus is it provided $70 million explicitly or specifically for childcare for Virginia for this year. It says that this funding needs to support parents of young children who have to work during this pandemic. It says it needs to support the child care sector. It sort of gives a lot of flexibility to states on how to use it. It says you don't necessarily have to have been part of the subsidy program. So normally when the federal government provides resources for child care, they really want that to support the child care subsidy program. This said, we understand that the impact felt by the private sector goes way beyond the child care subsidy program, and so really encouraging states to think more broadly. These dollars do not require matching funds and do not have a lot of the strings attached that typically the child care block grant does. And so, as the First Lady noted, Virginia really seized on this opportunity. I think the money hit the bank account on Tuesday, and the governor announced on Wednesday the ways in which we would be providing these resources to the field, but wanted folks to understand kind of the total amount of money and sort of some of the limitations, as well as to everybody to have the confidence that all of the $70 million will be dedicated to support childcare and the early childhood sector in the Commonwealth. So let's talk a little bit more about how this will work in the Commonwealth. Next slide, please. Before we jump into the weeds of the application program, some of you may have applied, some of you are thinking about applying, I wanted to share for all the folks on the phone the different needs that we have heard from the field and then the different ways in which we're using the funding. And then we'll talk about how you apply for each of these areas and then go into more detail on the biggest supportive funding, which is this first goal, which is for those programs that are open. So as I just said, the primary goal and the vast majority, or at least half of this funding, is dedicated to those providers who are open to serve kids during the pandemic. And so we just heard from those folks who had stayed open or were willing to reopen. It was such a different economic circumstances, the smaller group sizes, the need to offer hero or shero pay, the kind of additional cleaning supplies and PPE. the cost of operating was just was much higher during the pandemic, and they needed some resources if we wanted to stay open and be available to serve essential personnel. So that's our first priority, and we'll talk with Tara's help and very in detail about that program. Our second priority was recognizing our families, particularly those of essential personnel who are low income, who rely on child care subsidies in order to go to work and have their kid access child care. And we know that everybody's financial circumstances are worse off. I think roughly kind of half of the folks across the country are saying they're worse off financially than they were last month as a result of COVID. And so wanting to provide some flexibility to those families during this difficult time. So our families in the child care subsidy program will not have to make co-payments from April 1st to June 30th. The state will step in, cover those co-payments, provide them directly to providers during this time where we know everybody's just struggling to get by, providing a little bit of flexibility and help to those families. Our third priority was recognizing all of our providers in the child care subsidy program, even those that were temporarily closed. So roughly about a month ago, we announced that we would dramatically expand absence payments, basically kind of adding 40 days or roughly 8 weeks for our child care subsidy programs that needed to stay open. So if a parent had a concern about sending a child to a program, if there was, a need to quarantine for kind of suspected COVID case, we wouldn't put parents or providers in this place of saying kid has to come, and therefore potentially expose, other kids or the educators or other families, that we would provide a lot of absence payments to kind of provide some continuity and make sure that we didn't have sick kids feeling like they had to come to programs. We at the time didn't offer that to close programs, noting that we really wanted to encourage folks to stay open. But what we've heard from our child care subsidy providers who had to close temporarily for whatever reason is that they've also kind of experienced tremendous financial losses. We want them to be part of the subsidy program when we are back at full speed in the Commonwealth, and so also offered them a parallel provision or an additional 40 days or 8 weeks. And so basically allowing them to get paid for enrollment for at least some period for this closure as a way to help them make ends meet financially, and then make sure that we have enough providers as we come out of this crisis in our child care subsidy program. And then lastly, we held aside a little bit of money in the places where if there's not sufficient child care in the private sector, that we can work with schools and municipal governments to offer backup emergency child care. If all of the homes and centers, there's not enough capacity there, making sure that we have a backup plan, for the duration of this crisis, knowing that although we didn't have the peak and we haven't seen the numbers that have been seen in New York City and other places, that we want to be very careful. If at any point we don't want a health or hospital worker saying, I can't go into the hospital because I don't have childcare, and so making sure we've got a backup fund as needed to support that. So that gives you the kind of the overarching, here are the 4 areas, and then we can go to the next slide. Perfect timing, Val. Here's how you apply. And again, I'll talk in a second about the biggest source of funding, kind of the CARES Act application for programs that are open. But basically you'll apply through Ask for Care, and there's a lot of information on this program, either in the handout here in your webinar or on the Department of Social Services website, or now in that new app. For those providers who are participating in the child care subsidy program, who might be closed and want to apply for those manual absent payments, you can go to the FAQs to find out more information, or to submit your questions to vendor services at dss.virginia.gov. And again, you can apply for those manually. You don't need a signature for those manual absence days, but just go ahead and apply for those. For public schools considering emergency child care, they should email the superintendent at the Department of Education. And then for families who might be confused about copay or kind of want to know more about that flexibility, they can either go to the FAQs on childcareva.com or can contact their local eligibility worker, their local Department of Social Services. So that's how you apply across the 4 areas. Now let's talk in more detail about the specific program, the kind of the biggest investment here in our to support our providers that are open, regardless of whether or not you participate in the subsidy program. Next slide, please. So As I noted, the single biggest investment in the $70 million, and we're planning to use at least half of the dollars, is to support those programs that are open during the pandemic. Really, for the first time, these dollars are not limited to programs in the Child Care Subsidy Program, licensed child day centers, religious exempt child day centers, licensed family day homes, voluntarily registered family day homes, local ordinance family day homes, and unlicensed subsidy providers are all eligible for this grant program. We are not funding this program based on attendance. So we're not requiring you to register the kids. We're not requiring you to track attendance for two reasons. One of which, that would take a lot of time to get all of these kids and get all these programs on board. And what we want to do is kind of move more quickly. The second reason is what we've heard from you is that attendance is going up and going down. And again, we don't ever want to create an incentive for folks to feel like sick kids, or kids who have a fever have to come to programs. And so the way Virginia has structured this program is actually to fund you based on size and being open. And so again, this slide includes an example. So all eligible programs will receive a monthly payment of $25 times half of their license capacity. So again, license capacity is our best measure of size kind of across the board for each week. So, and roughly 4 weeks. So imagine it's about $100 times your half your total capacity per month. So for example, if your site's total capacity is 50 kids, your grant amount would be 25. So that's half of 50 times 25, or $625 per week. Now for 4 weeks, and that's about $2,500 for the month. So again, kind of a direct cash grant, not based on attendance, not based on the subsidy program, but based on size of your program or your license capacity. And again, there's been some question mark about sort of weeks versus months. You should generally think of it about 4 weeks per month. And so that is roughly $100 times half your capacity is probably the easiest way to do that math. To be eligible for the program, you must be open for the month applied for. And so you can do it for all 3 months. You can do it for 2 months. You can do it for one of these months, April, May, and or June. You must be willing to provide care for children of essential personnel. So you don't have to document that your folks are essential personnel. You don't have to send us documents. You don't have to have difficult conversations with your families. All we're saying that you need to be willing to provide care for children of essential personnel. You don't need to sort of push out current folks. If I can get a spot open, if you're full and a spot open, you would be willing to provide care for children of essential personnel. That would count. We're just trying to make sure we have enough open private programs across the state. That is the goal here, rather than kind of a detailed accounting of, is this parent essential personnel or not. We ask you to comply with the enhanced health and safety requirements that are part of the application, and really just reflective of best practice from the Virginia Department of Health and the Centers for Disease Control, and then you have to apply. I'm just going to emphasize this point. You see the turquoise application and the lower right column hand of the screen here. This is not like the stimulus checks. This is not something that they're going to automatically send to folks just because you're open and you've registered on Child Care Aware Virginia. You need to submit an application. We know a lot of folks have. If we'll move out to the next slide, we know we got I think 1,000 applications in the first few days, and we've already, the Department of Social Services, and huge thanks to Tara's leadership, have already approved 947 providers to participate in the CARES Grant Incentive Program. So very exciting. We had so many folks kind of apply, get their material in, and again, we can sort of work through the process to kind of get checks cut and getting out to people. So a few tips for applying before we open it up for questions. I think the biggest one is making sure that your application is complete before submitting. And so on the right-hand column, and if you click on that blue button there, this is a checklist to make sure you have all of the documents that you need. And so kind of, you've got to have all of these. You need to submit them as one PDF or as one kind of application if you do it via fax, because we need to have all of these things in order for the state to cut you a check. So it's not just not just, kind of because we want more papers, but in order for us to cut you a check, we need to have these documents. It's a requirements in law, and we've pursued as much flexibility as possible, but we've got to have these documents. Make sure you mark all of the months that you will be open. So if you are planning to open in May and June, click for both months. If you are open now and you think you're going to remain open through June, click all 3 months. Save you kind of a hassle of having to fully reapply next month and the following month. And again, encouraging folks either to use fax or to use email to get them into one PDF or one document. And so I know everybody in this pandemic is using technology in new and different ways. Think about using a free scanning app on your phone to take pictures of the documents if you don't have a scanner at your home office or in your center, but really making sure you get them into one document when you submit them, to ask for care at dss.virginia.gov so you don't get the kind of incomplete and there's not that kind of back and forth. We don't want to lose your documents or have there be any miscommunication. So with that, and then you see at the bottom there, just that very exciting, highlighting the number as of 2 days ago. Just really pleased to say we've gotten, thousands of applications. 947 providers have been approved to participate. We know we expected, kind of more than that based on who's open, and so we're really kind of asking not only to get your own application in if you're still open, but to get the word out there. If you're thinking about reopening, and you're pretty confident, you're kind of ready to open, next month, applying now or applying as soon as you're open. But these are resources that we want to get to the field. These are not earmarked or have to be spent on any particular resource. This is not, for payroll or for PPE or for personnel sort of, it's not required to be spent on those ways. All of those are eligible ways. Think of this as kind of a grant meant to sort of close gaps, use it on what you need to use it for. You don't have to use it in any particular way. We just wanted to provide flexibility, provide direct resources to those programs that are open. And we know that you will be able to figure out, what your community, what your program needs, what your families need, what your teachers need. And so you have ultimate flexibility on how to use these dollars, but really encouraging everybody to apply and for us to be able to get these resources to our programs across the state. So with that, Tara and I will pause and then we'll just ask Kathy to start taking questions and sharing them with us.
Awesome. Thanks, Jenna. So much great information, and we've already gotten a good number of questions. And I think I'm trying to organize these in such a way that we can kind of knock out the easy ones first, in terms of many questions that ask for a kind of a repeat statement or showing the website for things like being able to identify or purchase PPE. We can go back to that slide. Also in the chat box, if you are joining us online, you'll see that the VECF team has attempted to chat the specific websites for the information that's been requested through the question box. And also just want to, clarify and make sure everybody understands that if they registered for this call and are participating, they'll receive afterward a recording of the webinar, a set of the slides, as well as links and links to some of the key sites and attachments, handouts that we've that have been referenced during this call. So just want to reassure everyone that you will have access to all of that information. And thanks for showing such great response and interest in the tools and resources that the state has tried to make available. That also includes finding the letter that defines childcare as essential personnel and enables you to access and be able to purchase cleaning supplies and PPE. Next, let's move to a few questions that have been raised, really more about the process for application and understanding sort of the some of the timeline. If we've already submitted our CARES grant application, when can we expect to get word that we were approved? And when can we expect payment to begin? Tara, you want to take that one?
Sure. So one of the things that, we're trying to stress to everybody is because this is such a manual process, it does take a little bit of time. and we have a team that are, really working hard behind the scenes to ensure everybody gets payment. So we're asking for patience in this particular area, but we are going to try, and we hope to have most of the payments submitted and headed out to you folks by May 15th. Obviously, it's going to depend on when some of these applications came in and what, if there were any issues related to them, because we obviously have had to send some back. And there's several different processes that this application has to go through for total approval. So once it leaves kind of licensing, we do have a finance group that takes a look at it. And so we've had a couple kicked back. So out of, just for an example, out of 300 we had yesterday being processed, and they process them in batches of about 200 to 300. We had 3 kicked back that we needed to have folks redo some things. And so I was going to bat trying to make sure that we didn't have to send some things back to you guys to see if there was some other things we could do. But in some cases, we do have to kind of go back and ask for paperwork to be resubmitted, and obviously that's going to delay the process, somewhat. But we're gonna try to get everything out by May 15th. But we do ask for some grace on that, because there may be instances where we can't. We're dedicated to making sure that everybody who applies can be approved. Obviously, that's a difficult process, but that's our goal, is to try to help folks work through this to be able to get the money in the end, because we know desperately how much folks need this. So again, the approval letters will come after finance has had an opportunity to enter them in and make sure that all those EIN numbers are accurate and things like that. So that's kind of a long answer to a short question, but patience is what we ask for, but you will hopefully hear something by the 15th of May.
Thank you, Tara. Next question is, the grant covers the period of April to June. Is it retroactive? I've just now learned about it, but have been open since the beginning of April.
So we would ask that you try to get your application in by, the latter part of the month, just to make it easier for processing in terms of finance. But we will take into consideration those folks that are just hearing about it. But we really would ask that you get that in as soon as possible.
And it sounds like, Tara, that April would be considered the full 4-week month for those who've been open, even though, just learning about this now, just applying, making the funds available, they would be able to be eligible for funding for the full month if they were open.
So we are, yes, we are retro. We are allowing them the payments to be retroactive back to April 1st. So, which kind of that's kind of part of the process too. That after we get this initial, everybody enters in there. If we get everybody's information entered in, May and June is going to be a piece of cake. So, the first couple weeks are the most difficult part. But yes, we will retro those payments back. So that's the good news.
Okay, terrific. If a center chooses to reopen in the middle of May, would they be able to receive a partial grant for the month of May, or how would you divvy up that payment?
So we haven't talked about the partial payments for May, but what we did in April, and I would assume, and I'll let Jenna kind of put the period behind this statement, is if you are making every effort to open for essential employees, if you've worked the majority of that month, or you have been open the majority of that month, then we would probably pay for the entire month of May.
Anything to add to that, Jenna?
No, I think the key piece, and at least what we talked internally, is shooting for the majority of the month, to get open. And so I think folks who can do that. If you can't do that, I think you can sort of email us at Ask for Care, and we can look at individual circumstances. But we would like to avoid partial payments per month. And so as folks are thinking about reopening, if you're like, well, there's just no way I can open by Friday, we get that. But if you could aim to be open for the majority of the month, that would be extremely helpful in terms of being able to just get you the 4-week amount.
Terrific, thank you. This participant says, I have a home daycare with a permit. Can I apply?
So when you say permit, are you meaning, are you an ordinance? I guess that's the question. We may have to have this submitted to the Ask for Care site, but if you're licensed through DSS or you're part of the local ordinances in Northern Virginia, you would be eligible.
Thanks. I think that will likely fit the bill. Thank you. Do we get paid for part-time subsidy children?
So Jenna, do you want to answer that one?
Yeah, I'm not sure if I know about that one. I mean, I would assume yes, but I think you probably want to email vendor services, unless you know the answer right offhand, Tara.
No, I don't. I know that that probably is a Barb question, because this particular amount, comes from a, even though it's still the block grant, it's a little bit different. So we can probably get Barb to have somebody on her team answer that, and we can maybe even put it in the FAQs.
Yeah.
Terrific.
Yeah.
Thank you. The CARES grant application initially indicated that you would need to submit an application for each month separately. Is that still required?
So I think, as Jenna alluded to in one of her comments, there is a space on there for the 3 months for you to check April, May, and June. If you check April, May, and June, you would not have to resubmit your application. So that just saves some steps in that process. So I think you're right. We probably talked about that initially, but I think as we move through this process, realized that if folks are open in April, the likelihood of them being open in May and June is probably pretty great. So we have that ability for you to check those boxes and not have to resubmit an application.
What if I'm open and willing to take essential personnel kids, but I don't get any? Do I still qualify for the CARES grant?
Yes, I believe that Jenna kind of spoke to that a little bit earlier as well. It's if you are willing, you get the money. So that's kind of an easy opt-in for folks. I mean, we're just, asking that folks be available to those essential personnel because, we don't know, when their situation will change and they may need you. So that's the good news.
Great. Thank you. If I sent the application via fax, do I need to send it via email?
No, you do not. So we have a group of people handling the fax inquiries as well as the email. So if you sent it in via fax, you're probably in good shape. As a matter of fact, that's been the easiest route for most of our folks, believe it or not. Who would have thought that fax would have been easier than email?
We have 2 different campuses that are open, each one licensed separately by DSS. Do we file a separate application for each one or combine them both on one application?
So we ask that you file those separately. That way it's easier for us to be able to calculate the payment. But what we are telling people at this point, because this is a little bit of a change since we initially rolled out the application process as well, is that if you are owned by a corporation or you have multiple facilities, even though we're asking you to apply separately, those checks will go to your corporate office because it's basically under one EIN number. So those EIN numbers will be batched and they will be sent to your corporate office. So we're asking that folks make sure that when you receive your approval letters back, that you do share those with the folks in your corporate office as well. So you guys can kind of do a double check to make sure we've sent you the right amount of money.
Thank you. There's still a number of questions about how they'll know if they're approved. Would they expect an email response? When would they be notified that they're approved? Tara, would you just walk through the timeline again and this may just, help your team in terms of not, receiving a bunch of calls and emails about when, if I submitted, but I didn't get a response, just so that they know what to watch for and when.
Right, and I'll go back to my statement about this being a manual process. So what happens is when this information is received, we're not sending anything back saying we've received this. I mean, it sounds like it would be easy to do, but we have so many applications coming in, and just trying to get them processed and get them in for payment is kind of our biggest obstacle right now. So we are not sending out acceptance letters until they go through that financial piece and finance tells us, yes, we're getting ready to cut a check for this. Those will be emailed out to folks with their acceptance letters. You know, on the check, there should be some information too, but you should get the acceptance letter via email before you receive your check.
So if folks are still asking, how can I check to make sure my application was received? You're saying if they submitted it all, they will in time, not immediately, but in time, get an email or a phone call if there were any areas that were incomplete, or if they need to submit anything further. Otherwise, they should assume that the application was received and is in process.
Yes, absolutely. And I know that is a bit frustrating sometimes when you're waiting, but you know, again, it's just right now that's the process that we have. And I think if we are able to add to this text and this phone application process, which, you know, I'm thinking that by the time we get to that point, that we'll probably have most people will have already applied, but we will have a different avenue for folks to submit possibly in May. But for now, just hang tight and trust the process and realize that if you haven't heard from us, it's probably a good thing. And we're probably in the process of doing the approvals and getting your checks and your approval letters cut. So I would, you know, kind of keep an eye on our website too, so that we can, you know, we're going to try to communicate through that as well if there's any changes or anything that folks would need. But if we have any information that we've received from you, we will contact you if there's a problem. So just don't worry about that.
Here's a good relevant question. How will we receive our check, mail, or deposit?
It will be mailed. Those checks will be mailed in by, you know, normal mail delivery. We do not have the ability right now to do any type of direct deposit. We've got that question a lot, which is interesting.
Will everyone who applied receive it?
Well, that is the hope. Now, there could be circumstances in which folks may not receive it, but we haven't run across anything just yet. We don't want to blanket, you know, put a blanket statement out there, because there may be issues if folks don't have an appropriate EIN number or tax identification number that may prohibit you from being able to get funds. So we haven't run into that yet, but we'll see. Hopefully not.
Yeah, and I think from a budget perspective, you know, I think we've, you know, and partly why we in this first round limited to April, May, and June is that we are, you know, we can't guarantee, but we're fairly confident there's enough for everybody who's open to receive this. So, you know, this hopefully is not like the PPP situation where there's a rush and they're just going to run out, but that there should be enough to support everybody that's open.
My program offers 3 shifts and my capacity for each shift is 12. Do I add the capacity for each shift or just sum to 1 for the CARES grant application?
So it's not really based on your numbers of how many kids you can take right now. It's based on your licensed capacity. So when you received a license from us, there was a number that was on your license. And so that's what we have used in terms of calculating your amount that you will receive. So in most instances, it's very generous because most folks aren't, you know, able to care for that amount even at half of the license capacity at this point. So we've been very generous with the amount. So I wouldn't worry about calculating that. We have calculated that out for most situations. I think maybe the place where we would be concerned about that is if somebody had received a modification for a license. And so, you know, but we've pretty much, we kind of calculated that ahead of time for most all of our licensed facilities and providers. So we'll take a look at that on each individual basis, but usually it'll be more than probably what you would anticipate.
If a provider is and has stayed open and also has received both PPP, the Payroll Protection Plan, and EIDL funding. Is there any reason not to apply to this grant?
Jenna, you answered that the other
No.
day for someone, so
Yeah,
I'll let you take that.
no, I think you should. Yeah, I mean, I think that's sort of, and it's a great question. Those are kind of, generally speaking, specific loans for specific purposes, and you know, we that's our understanding of those things. We structured this as a more of a general grant, so there's not a expectation that it's spent on any particular thing. It kind of falls in the category of what the kind of federal block grant considers quality grants, which you know, just can be used as incentives, can be used for whatever purposes. So you know, without knowing anybody's individual circumstances, you know, so you talk to your advisor really on that side in terms of whether there's any kind of conflict. But from our perspective, we don't have an expected use for this. Your eligibility is based on being open for the majority of the month and your size. And then from there, it's really up to you on how you want to use it. So you should be eligible, even if you have received other resources.
Super helpful, thank you. Here is a questioner who says she's currently closed due to the enrolled parents are working from home, and some are not attending due to concerns, you know, health concerns, and they're not essential personnel. Are there grants available for this provider?
So I think that the answer is still, if you are willing to accept essential personnel, then you would be eligible. That the overarching question is, are you willing to accept those folks if indeed they would need services between now and, you know, the end of this period of, you know, if we, you know, cap it at June, the end of June.
Okay. Now, there are two questions from the same questioner, and both linked to this option or the potential for emergency childcare in a public school. So, Jenna, I'm going to toss this to you. Here are the two questions. Can we provide emergency childcare in a public school if necessary? And if we're not full, will referrals come to us? I assume this means a childcare center, rather than have a close public school be opened as an emergency childcare unit.
So the first question about could you provide it, that's really a local decision on how folks want to approach emergency childcare. We do know in a handful of communities that private providers have worked in partnership with their municipal government and with their schools to open childcare programming in schools. Sometimes it's run by the private provider, sometimes it's run by the schools. And in our guidance document, we walk through, you know, what that means in terms of licensing. If private providers who work with schools and happen to be open in school settings would be eligible for this grant, if you, again, you know, provided you meet all of the other qualifications and the space is licensed. It works slightly differently if the school is running it directly. As it relates to the referrals, again, this is local discretion. We are strongly encouraging folks to work with private providers, engage private providers. The guidance that comes from that email address, superintendent@doe.virginia.gov, really encourages folks to work with private partners, as we recognize that, one, they are the experts, and two, they are the providers we will need, you know, before, during, and after this crisis. And so we would really encourage folks to reach out to your superintendent, oftentimes it's sort of a superintendent, sort of sometimes like board of supervisors, maybe your city manager or county manager rather, and kind of make sure they're aware, let them know about the map. You know, we've been advising, and as we sort of monitored this, is really, you know, strongly encouraging folks to start with their private providers and helping them be aware of the kind of capacity provided there.
Thank you. We have a few questions that I think relate to items on the application. Can you talk through for one of our questioners what you mean by entity classification and how that should be considered?
So usually when we're referring to an entity, we're just trying to figure out if you're like a family day home, if you're a child day center. We have a couple different types of centers out there that are applying, so it just helps us differentiate a little bit. There's also, I think, the legal name and those types of things, so I'd probably have to kind of go back and look at that application to see where that's located on the form. But if there's quite a few questions around that, we can look at offering some FAQs around that too.
And here's a question, Tara, that may be related or may, give a little bit of additional info about that question. I'm a family child care provider with a blue permit. Do I qualify for the CARES grant? I've been open April, May, June, and beyond. So I think some of these are about more local ordinance or permitted.
Okay, because I'm like, I don't know what a blue permit is.
And then we also have a question for somebody who's part of the infant toddler group in Fairfax. So if folks are sort of, maybe don't fit in any one of the options on the application, how would you recommend to them that they get answers to their specific questions or figure out how to proceed with an application?
So we worked with the person who's over most of the local ordinances up there to develop a little bit of a different application process for those folks. So I would just go ahead and email the Ask for Care, and then we can get the right person on the phone to be able to kind of walk you guys through that, because I know there's been some questions about that. So we're handling those folks just a little bit differently, because we kind of, I guess, grouped the local ordinances in at a little bit later time, and we had to back up and redo some things with the application for those folks. So,
okay, how much time do we have to apply for the grant? What would you recommend in terms of thinking about the timeline for getting applications in?
Well, I'll defer to Jenna on the actual timeline. We would like to see that if folks are going to apply, I mean, obviously they can apply in every month. Let's, for whatever reason, if somebody can't be open and you may not know what situation you're in now, today you may say, I just don't think I'm going to be able to open. But you see, midway through May that, hey, I might be able to open for the month of June. We wouldn't prohibit you from doing that. We just want to make sure that if you think that you're going to be open, go ahead and kind of let us know. But, I think that's, we're going to be flexible as much as we can related to that. And we understand that there's some circumstances where folks just may not know what they may be able to do, and they may have some other things to process through in that time frame. So if you decide, mid to end of May that, hey, I think I can open in June, then we probably won't turn you down.
Great. There are a couple of questions that I think relate to, what are the best channels of communication for providers to make their openings or availability known to parents of essential workers or employers of essential workers. So one is, I have a brand new school right next to Novant and Kaiser and Haymarket. Staff is ready to return to work and open within days for essential workers. These funds are perfect to make that happen. Are there sources for the medical establishments to get the word out to them? And then a related question, which I just love, where are all the children of essential personnel? Some of us are open with open enrollment vacancies and no children of essential personnel. Any ideas or thoughts from you all about how to make these links and connection between essential workers needing care and providers willing to offer it?
So the first line of, that we want to make sure everybody understands is that Child Care Aware website. That's the first line of, I don't say first line of defense, but that's your first, kind of first stopping point on this road to essential personnel, because they are we are having conversations with like Virginia Healthcare Association, VHHA, Hospital and Healthcare Association, and a multitude of other folks out there in regards to provider groups, and are letting them know about child care aware and asking them to have their employees go to that site should they require childcare at this point in time. I would also reach out to those folks that are just around you, because I know that, you know, sometimes folks just still aren't aware. They may not have heard that, you know, we are, you know, providing childcare. Childcare is open in Virginia. So, you know, I don't think that would be a bad thing to do, is just, you know, actually make them aware, contact them and make them aware. But we are working on your behalf with those agencies out there to try to make sure they know to go to Child Care Aware if services are needed. So I think, you know, we're doing our best to try to help you guys out with that. So,
And maybe just another plug from y'all about Child Care Aware, and for providers to, you know, update them regularly, and also that information is really useful to parents of parents who are essential workers and looking for options.
Yeah, and the one thing I would add too, Kathy, just in the spirit of transparency and reducing some of the feelings of isolation, is to know that you're not alone in that. We are hearing from communities across the Commonwealth that that sort of two things have changed. One of which is, as I noted earlier, you know, there's just a lot more fear on behalf of parents, and that was reflected last week in a national survey of families of kids in childcare, and 75% of them, or 3 out of 4 parents, were saying they were, you know, really concerned about safety of group care right now, based on everything that was going on, right? Which is, you know, and again, even, you know, these are all folks who were in childcare before, who trust childcare, right? But that's just a very real feeling. And I think the second is that, you know, a lot of parents have very different financial circumstances. And so when we've talked to programs who, you know, I think sort of felt the need to open or offering to be available, and then feel like, you know, they've built it and they don't come. And so we that's partly why we wanted this grant to focus on folks that were open. And like partly, as Tara describes, that we are, you know, continuing to beat the drum and let all our hospital systems, our big chains, our economic development people know about the Child Care Aware Virginia website. But I do think, you know, it's going to take some helping, you know, families reduce some fears, you know, making sure, you know, I think the state can support in that, and some of our messaging, really encouraging folks to, you know, to kind of reach out to families one-on-one, talk through some of the things that you're doing, talk through. A lot of our families aren't aware of the new CDC guidance, or, you know, that you have a smaller group size, right? They've been in, you know, in the chaos of their own crisis for the last 5 weeks. And so really encouraging people to not underestimate the importance of relationships, you know, and sort of talking to families and all of those channels to build trust back. Not that it was anybody's fault, you know, in terms of the kind of the fear. It just has to do with everything that we're being fed on the media and the kind of the concerns. And so, you know, you're really working with parents to help, you know, adjust those fears will be kind of a shared challenge for all of us going forward.
okay, and Kathy, can we just back up just 1 second, because I was looking at that application, so I wanted to make sure that when I looked at, I should have had it in front of me, so I apologize. But the business entity that someone was actually asking about, it's more related to if you're a partnership, corporation, LLC, or that type of thing. I had to jog my memory by looking at it.
Okay, thank you. And just kind of a clarification from the questioner about the Blue Permit. The Blue Permit is issued through the Department of Community and Human Services Center for Children and Early Childhood Department in Alexandria. So just to let you know about that. Also, a good friend has let us know or reminded us that a large number of essential personnel and first responders do not have the language skills or the access to technology and are struggling to find childcare. Is there anything the state can do to share information in different languages to parents who need help?
Well, that's a very good question. I think that we do have some opportunity especially in our Northern Virginia areas, to look at some options for that. So we'll look into that and see what we can do.
Thank you, and thanks
Yeah,
for
and
being
just
so
a reminder
responsive.
for parents, Kathy, just a reminder for parents, it's 866 Kids TLC. They can, of course, use the website if the parents have, internet access or have web access on their phones. But we're also oftentimes encouraging parents to go to 866 Kids TLC and just use a phone, and they can understand what's available to them, that way.
Okay, and translation services available on the phone line?
I believe so, yes.
Okay, thank you. And just want to, say again how much it's appreciated, how responsive you all have been in this process, Tara and Jenna and your teams. Lots of appreciation for that. One questioner is wondering about if there is a center that are open or considering to reopen and provide care for essential personnel. But they don't have access to be able to or can't afford to purchase PPE. So we've provided websites for providers to go to order and purchase PPE and other supplies. Do you have suggestions for those who may not be able to afford those?
That's a very good question. I know that, we have some opportunities through some of the healthcare coalitions and stuff to access, but I would have to check with our partners to see what we could do in terms of childcare and childcare providers. I would say that if you're really having difficulty finding it, you're not alone, because I think there's a lot of folks out there that even if they can afford it are having a hard time, finding it. But go ahead and email the Ask for Care email address, which we typically don't want to do, but I will say for this particular issue, we can try to see if there's some opportunity for that. And it just reminds me of a couple things that we have out there that we may be able to assist with. And I still need to get with you, Kathy, on a couple of those options where you may be able to we may be able to hook you up with some ways in which we can help those folks as well.
Sure, sounds good. And Tara, I think that, as you mentioned, we've been noticing there are examples of local philanthropic groups or relief funds that have been kind of locally developed and administered that seem to be great opportunities for that sort of effort, especially the affording the items and the supplies. Let's see, I want to get to a few more of the questions that folks have entered, and some of these are a little bit more specific, and Jenna will kind of want to go back to your slide about the how to calculate the amounts for the grants. So if you can help walk through for a couple of folks. Let me find the questions. Well, first of all, is the $25 an actual number or used only for illustrative purposes? And then secondly, I have 12 children. I have a license for 12 children. So how much can I receive weekly?
So yeah, so the 25, the first 25 in this example, and that's a little confusing, is not illustrative. It is the actual amount. The second, which is the 50 divided by 2, is illustrative. So the 25 times half of your license capacity times each week. So it might be easier to do it by a month or 4 weeks. So you would do 100 times the capacity of 12 would be times 6, or $600 a month is what you'd be eligible for.
Okay. So the calculation is $25 times 6 times 4 weeks.
Yes.
Gotcha. Thank you very much. And just doubling back on the PPE items, home providers are able to use the resource that you provided to order PPE, just double checking if that's eligible, if home daycares are also eligible.
That was my understanding.
Okay, great, thank you. Let's see, and with this, what is the ratio of adult to children for 2, 3, and 4-year-olds. So I think the question is, what does the ratio and group size that would typically be, how do they sort of think about that in this COVID era with the max 10 per space restrictions?
So I think
Carrie, do you
one
wanna answer
thing
that
to,
one?
yeah, one thing to kind of remember is, one, really the ratios haven't changed a lot. So I know that the folks that we talk to, I mean, the issue is how do you, you have the unless you're dealing with the younger children, the 1 person to 9, basically, because you have 10 in a room. That's kind of the rule now, is in terms of what the governor has laid out. And we understand that's very, very difficult sometimes when you're dealing with kids. And we have some FAQs related, specifically related to that, and on our website. So we could definitely, if you go to our DSS website, it talks through a lot of that, in terms of how best to kind of handle group size and how to handle, different types of activities, and then walks you through a lot of different things that you can do in the classroom to help keep those kids separated. If I'm understanding that question correctly, because, the ratios really haven't changed in terms of childcare, in regard to this.
Thank you. I just appreciate so much the diligence that providers are showing, and, wanting to try to make sure that they're meeting requirements and doing, their due diligence about what is expected. So just really respect that. Here's another hypothetical question that sort of fits into that same category. If the center receives grants for example, May and June, and during operations, the center gets closed temporarily due to confirmed cases of COVID, would the center be allowed to keep the grant regardless of the fact that the center might not be able to operate due to temporary closure?
So I think we've said, and it may be part of our FAQs as well. I think we may have included that in there somewhere. But if you're having to close because of COVID, that's kind of an expense related to the child care process. So typically that's just a couple of days, and you would be back up and running. So that in and of itself would not prohibit you from continuing to get your full amount for the month. I mean, again, what we're trying to encourage is that it's the willingness to be open during that time. And obviously there are things during this pandemic, especially if you have a positive case and are required to do a deep cleaning, that is going to involve some downtime for you as a provider. So
great. I think we've received several questions related to, maybe you could provide a fairly simple way for folks to check websites or resources out of either the Department of Health or the Department of Social Services to indicate what types of PPE should or could be used, what kind of safety measures are required in terms of the use of PPE.
So I think and I'll turn it over to Jenna, because I know we answered this the other day. A lot of what we're asking folks to do is look we have links on our website to the CDC website that really talks about, the proper how to don that that protective equipment and the types of things that would need to be used. And I think obviously the two biggest things, and then depending on the age groups of children that you would be caring for, you want, the masks and gloves are, probably two of the primary PPE supplies that you would need. But if if you're dealing with smaller children and you're going to be, obviously if you have to hold, if they're younger children, you have to hold them to feed them and things like that, you would probably want to have a gown or something like that. So there are, some, and I think we've got the slide up here that you can go back to kind of see maybe the best way to access that and to use that equipment.
Thank you. We have just a few more questions. You all have done a great job of responding to so many. We'll just remind folks we have a few minutes left if you want to type more questions in the box, but we'll kind of handle these last few. let's see, if someone does not have a subsidy vendor ID number, I assume they're wondering if they can still apply for, which components of the grant, or what would you recommend?
So you do not have to be part of the subsidy program to receive this money. So that's not something that's required. So
if people are applying for a new license for family day homes, are they eligible for this package, or is it strictly for existing caregivers?
So it would, if you can, can make that happen. I mean, we're obviously asking, we're trying to help folks, who are providing childcare or who desire to provide childcare. We have some expedited processes these days during this time to be able to help folks do that. It's still somewhat, it's probably not going to be quick, but hopefully it would be, instead of months, we're talking about maybe a week or 2 weeks to get up and running. But you can definitely, once you are licensed, you can apply.
I think y'all have done a great job of sort of underscoring and making it clear that your main objective is to make sure that there is available care for essential workers. And these grants are there primarily to support that capacity, and that there's no restriction for additionally enrolled families in programs that are open, but that the priority is for serving the children of essential workers. We've had a question that sort of kind of has kept creeping up into the conversation, and not sure how y'all want to address this, but of course, childcare employers have in mind that the unemployment benefits right now are really attractive. And do you have any advice for center directors and employers about how to keep the center open or get staff back to reopen when unemployment is offering such robust benefits right now?
So I think that is a huge challenge, and I think we see it on the other side of the fence with healthcare workers as well. So it's a challenge, but those benefits are short term, I think, is one of the one of the reminders for folks. I think Jenna pointed out a little earlier that sometimes folks are just nervous and they're still a little apprehensive of going out and working. So, we are looking at options, in terms of how to assist people who want to work, and get them out there. I know a lot of the Employment Commission is working on that. And Jenna, I don't know if you have anything to add. You may have a little bit more knowledge on that side of it than I do, but I know that there's a lot of different folks out there who are trying to match up people who want to work with centers that, and not just childcare, but others as well. But we definitely want to make sure we get your names in the pot for those folks who are, struggling with staffing issues right now.
Yeah, I would echo everything that has been said. I think at the state level, we're tackling that and looking at things like job sharing and how to kind of, adjust the program to meet the needs as we shift away from kind of immediate crisis into longer term recovery. There's a lot of efforts happening there, and really, I think bringing together childcare industry with the sort of broader business industry is really important. I also think, and again, the reason that we set up this program to be pretty flexible, to be month by month, is an acknowledgement that that there's kind of what's happening community by community and even program by program is pretty different, and that there are places where you might be located next to folks who are working and people are ready to go back. There are other places where there might not be as much of a need for childcare if a lot of folks are unemployed right now. And so we are hearing increasingly that it's an issue in terms of employees. I think, as Tara noted, it is in the short term. And so figuring out what we need to do both within the childcare industry and in partnership with our business industry, our chambers of commerce, our other groups to figure out how to get folks working again is a shared challenge. So folks shouldn't feel alone in that, and we do acknowledge that that issue is going to continue to bubble up and take some kind of partnership and some kind of different types of thinking in order to address that. So thanks for flagging that for us.
And I think, just to add to that and just, seeing sort of all the continuous questions still related to this, I think that just recognizing that these providers are, who are staying open or willing to open and, anxious to provide services for essential workers, but also thinking from a business perspective, if they're open and having the cost of being open and have the opportunity to serve other children whose families may not be essential workers, I think, maybe it's that sort of tension that we're seeing through this continuation of questions. And so just from a business perspective, how do they balance that? If they open, fill their slots, make it, freely available, make it clear that they're open and willing to take essential workers, but their slots become full with other families. I think that's what they're grappling with, and just want to make sure they understand and how to deal with that sort of business and accounting really issue.
Yeah, and I just want to emphasize again, I think the, that folks are willing to serve essential personnel is the language that we're going to reiterate. We are not telling anybody you need to turn anybody down, right? You don't need to hold spots for essential personnel. We know, even in some of the industries that are officially designed or sort of defined as non-essential, if that parent needs that job in order to feed her family or pay her rent, but that in of itself is essential in some way. And so, it's all a balancing act. We're asking you just to say, I'm willing to serve them. We're not, interested in kind of accounting at that level, because we do know that, folks who have jobs right now need to be able to go to those jobs, and we don't want to, kind of split hairs there. And we know that everybody's grappling with that. We know that the essential personnel, even that term is defined differently on on one TV station versus another, is defined differently in different industries, is defined differently by the federal government as compared to the state government. So it is super confusing. But what we're really sort of saying is, if you're open, if you're available to do this, you'd be willing, if you could, right, not having to kick anybody out or change the way you operate, then you're eligible for this program. It's flexible cash dollars. It will not, and I should have said this earlier, Kathy, it will not cover the entirety of the financial hurt experienced by this sector, right? It doesn't solve all of the problems of unemployment. And just, we want to acknowledge that, not to shirk our responsibility, but just to acknowledge that, this is just sort of a catastrophic event for the child care sector. And so, we see this as one small piece of helping Virginia recover, and just want to kind of recognize that, but our work is not nearly done. And so continuing to hear this feedback on, what could help and what's still not working. That unemployment issue, I think, is only going to get bigger and bigger, right? As folks are just going to say, this is, better off for me economically, and how we balance these things. Just know that we really appreciate hearing from folks, and, know that there's a lot of work ahead of us as we support the recovery of this sector, which is so essential to families, and to the Virginia economy.
Thank you, Jenna. And thanks to both of you for doing such a terrific job of answering so many questions. Really appreciate the folks on the phone and online for sticking with us and for asking such good questions and helping us tease out the issues that remain. Really are admiring and appreciative of the way that the state agencies are attempting to utilize these dollars and be responsive to provider needs and concerns, and to make sure that we have care available for families who need it. Lots of thank yous coming across for you guys, Tara and Jenna. And just want to, I see our time frame coming up toward the end. Any closing statements from Jenna or Tara before we close up?
So I think for me, I just, I think we always want to make sure you guys understand in the field just how much we really appreciate all that you're doing. And we understand that it's difficult times, and, it's folks who run into the fire. And though, you are those folks, and we just so appreciate what you're doing in this time, that it's hard work, but you guys are the experts. I think Jenna alluded to that earlier. We are just so grateful for what you do, and, we're here to help you. And so, don't hesitate to reach out to your licensing folks if there's something that we can do to help you. We want to make sure you understand that we see ourselves more as a resource right now during this time. So, we've shifted hats. And so if you need something or need us, just reach out, and we appreciate all you're doing.
Thanks to both of you. And again, I think the questions that folks ask are really informative for you all, and help you all think about, refining and being nimble in terms of how you're deploying these grants and dollars. So a great conversation today. Thanks to everybody, and stay safe and well, and have a good day.
Thanks all.